Hello, I'm Paul Barr for Hospitals and Health Networks. The American Medical Association is trying to transform physician training using ideas generated by medical schools in a project it is calling Accelerating Change in Medical Education. As part of the second round of the project, the AMA invited 31 medical schools and school collaboratives to submit full proposals on how they would go about transforming medical education. There was a lot of interest, with 119 applicants participating in the first round. The AMA plans to give $10 million to 8 to 10 of the applicants in the second round of the process, with the selection set to be revealed in June at its semi-annual policy meeting. I'm here with one of the leaders of the project, Dr. Susan Skochelak, the AMA's Group Vice President of Medical Education and Director of the AMA's Center for Transforming Medical Education. Thank you for joining us, Dr. Skochelak.
My pleasure. Thanks for asking me.
Why is this project necessary? Why couldn't it just transform itself?
Medical education is changing all the time. It's not like nothing has happened. However, most of the changes that occur are around the things that have to do with curriculum or certain content areas. But the American Medical Association joins a number of other groups that knows that there are gaps that are occurring in the way we train our physicians. The American Hospital Association, through its Physician Leadership Development Program, put out a white paper talking about those gaps. Physicians are not ready to enter the practice world when they finish training. They don't have enough understanding about how to work effectively in teams. They don't understand enough about the healthcare finance system, what their role is vis-a-vis generating charges and those kinds of things. So about 10 years now, there's been a general agreement that big changes are desired. They just haven't happened yet.
To an outsider, the effort, it might seem a little open-ended. Is that the intention, or is there some sort of direction that you'd like to see the suggested transformations go?
There are very clear directions that we've set forward to work in partnership with the medical schools. So you can imagine there are lots of ways that you could think about changing, but we selected dimensions that make sense for our strengths and the strengths of the schools and their readiness for change. So an example would be the fact that students get very little information about understanding quality improvement, performance improvement, enhancing patient safety, physician-led healthcare teams. How do you really work? You're not alone. You're with the whole team all the time. How do you be an effective leader, or how do you enhance the opportunities for patients' outcomes to be the best that they can be? So we're selecting schools based on criteria that we told them before the 119 submitted their applications. And then now they're developing those ideas in a more sophisticated way so we can select the best of those.
What would you expect to be the biggest obstacles, if any, to getting these changes to actually work?
Medical schools want to change. It's not like you have to put a stick out there and say you're not doing a good job. They are doing a good job. And I think the ideas that they came forward with were very exciting. For their standpoint, one of the biggest obstacles is the opportunity to develop, and we're providing the funding so that they have, over 5 years, the time to really design, implement, and develop the programs, get them all in place. On the macro level, some of the challenges have to do with regulation and funding of medical education in general. How many slots we have for residencies, how do you enter a residency, some of those things we will also be working on as well.
How did the AMA come up with the number of $10 million? That seems like a lot of money for this kind of project.
We did research and benchmarked to see what are other foundations or other organizations doing. I did a number of interviews over 6 months with deans and other leaders of health systems and healthcare as a way to say, what's the right amount that would help you get to where you want to be? You know where you want to go. We'd like to help you get there. And it's a 5-year award for each school. So we'll have about 8 to 10 schools, and each of them would receive funding for 5 years, about $200,000 a year for those 5 years.
What about population health? We've heard about some medical schools adding classes or programs in population health. Is that an aspect that you could see being a part of this project, changes, trying to make that part of the curriculum?
You know, that's very much a part of this project, and it has to do with understanding systems of care, and that physicians need to understand within the system of care, how can they improve the health of populations? It's not just one patient at a time. That patient-doctor encounter is important, but what we're all working together, physicians, nurses, hospitals, everyone with the patients, is to improve everyone's health. So that's the population medicine part.
I noticed too that you've invited medical students to submit their own ideas using social media like Facebook or Twitter. How successful is that, and what are you going to be doing with that information?
It's been exciting because the American Medical Association has the largest medical student organization in the U.S., and they're very involved, very active. Many are outstanding leaders. In fact, we have 2 medical students on our national selection panel to help be sure that the voice of the students and their viewpoints are well represented. Sometimes they know better than we do. They're in the middle of the education, and I think they have a viewpoint that really is unique and needs to be listened to.
How does this fit into the broader mission of what the American Medical Association is trying to do?
The AMA has embarked upon 3 projects that relate to our mission, which is to support the art and science of medicine and the betterment of public health. That's a broad mission. In order to be effective, we're focusing in 3 major areas to have the maximum impact. The area that I'm working in is medical education. Very excited for AMA to be a leader in this area. Our historic leadership has made important changes. But as importantly, we're committed to improving the health outcomes of the American public. So working with doctors, communities, and patients on specific health conditions so that we can all rise to the best health that we can be. And then the third area is to help physicians with understanding payment and delivery systems and to understand the best ways to work within environments to maximize their satisfaction.
So why is the AMA focused on medical schools?
We started in our history focused on medical schools, and we continue to have a role with medical schools through the accreditation process. Our organization and our sister organization, the Association of American Medical Colleges, together sponsors the accreditation group that makes sure that all medical schools in U.S. and Canada are up to the standards that we set. So our history is with medical schools, but as importantly, we work across the continuum. We represent the practicing physician. We work with residents in training. So this initiative, starting at medical schools, spans in both directions. It will affect the kinds of students that are admitted to medical schools, and it will change the way in which, now that they're prepared differently, leaving medical school, entering residency, and then ultimately being very well prepared to practice as they go out into their full career.
I appreciate you taking the time to speak to us. Thank you.
Thank you very much.
For Hospitals and Health Networks magazine, this is Paul Barr. Thank you for watching.